My name is Linda Treiber, and I'm a professor of sociology in the College of Humanities and Social Sciences. I earned my bachelor's degree in sociology, but instead of going to graduate school right away, I decided to get a nursing degree. After taking an undergraduate course in medical sociology, I realized that I needed to know more about the body, illness, and pathology in order to be successful in that field. I figured that nursing would provide that, and it did. But more than just getting a textbook education, nursing was very hands-on. I liked how holistic it was. During my time as a nurse, I enjoyed getting to know the patients, working as part of a team, and being able to solve problems. I was a practicing registered nurse in cardiac care, diabetes, and community health for about 20 years before turning my focus to academia and research in medical sociology, earning a doctorate in sociology. As a nurse, one thing that really grabbed my attention was when mistakes and errors happened in healthcare. Unfortunately, I witnessed too many of these. Greater understanding of how mistakes occur and how they can be avoided became the focus of my research at Kennesaw State. I met Dr. Jackie Jones in 2008, and she was a nursing professor at KSU. A nurse educator for 20 years, she has extensive experience as a clinician, primarily in acute and critical care. We found we had mutual research interests. Shortly thereafter, we got our first internal grant from KSU's Center for Excellence in Teaching and Learning to study medication errors. Dr. Jones, now Professor Emerita of Nursing, has been the perfect research partner. Much of the national dialogue on medical errors grew out of To Err is Human, a year 2000 report by the Institute of Medicine, which is part of the National Academy of Sciences. Here, the Institute of Medicine's Committee on Quality of Healthcare in America noted that medical errors were estimated to kill about 44 to 98,000 people per year. This made it the fifth leading cause of death, more than AIDS, breast cancer, or motor vehicle accidents. As shocking as that was, subsequent studies have shown that the problem is much worse. In 2016, Martin McCary and Michael Daniel of Johns Hopkins estimated that medical errors kill around 300 to 400,000 per year, making it the third leading cause of death. Medication errors are just one type of medical error, a subset, and a particularly common one. Since nurses administer most medications, they are most likely to be the ones involved in errors. Simply put, medication errors happen when there's a failure to follow the 5 rights: right patient, right medication, right dose, right time, and right route. While this might seem basic, just do all those things and there will be no mistakes, the situational context matters. Nurses are held responsible for mistakes but have little input on working conditions. Their voices were not being heard. So our goal became to better understand the medication error processes from the nurse's point of view. Our initial study, When the 5 Rights Go Wrong, yielded several important findings. First, we identified many of the common causes for errors: rushing, distractions, poor staffing, and confusing or unclear medication orders. We also found that 79% of nurses in the random sample survey had made an error at some time. What was surprising were the deep emotions and visceral reactions felt by nurses who had made errors, and that these reactions were not always related to the severity of the errors, nor diminished by the passage of time. Nurses were deeply disappointed in themselves, devastated that they'd made an error. It wasn't long after our initial study that we encountered the second victim phenomenon. The term, coined by Dr. Albert Wu of Johns Hopkins University, first referred to physicians who had made a mistake and then were shamed by colleagues. They doubted their own professional abilities. That's what was happening to the nurses in our study as well. In 2015, we received additional internal funding, this time from KSU's WellStar College of Health and Human Services, to study Bachelor of Science in Nursing graduates to determine if they were being prepared to deal with the inevitability of mistakes. We found that they were indeed making errors and that many felt inadequately prepared. What was also concerning was the wide variety of medications that had been given incorrectly, including narcotics, blood thinners, antibiotics, a variety of intravenous solutions, and insulin, many of which already have system double checks in place. Our current collaboration is with nationally known experts from the Institute for Safe Medication Practices, University of Missouri Healthcare System, and Case Western Reserve University to produce a white paper on best practices. The goal here is to synthesize three main strands of thought in preventing errors. First, educational prevention strategies that include awareness of the need for system-level fixes. Next is the second, victim awareness. Nurses who make errors have not only experienced guilt and shame, some have been fired and face legal charges, even murder. We understand that some errors are the result of careless or negligent actions and should result in some type of punishment. But many other errors are complex system-level problems, including shift work fatigue and new technologies. Two extreme cases come to mind. The first, incorrectly administered epidural medications to a woman in labor, resulting in the mother's death. She was charged with criminal negligence. A pediatric critical care nurse made a drug error on a critically ill infant who died. She subsequently hanged herself. How to help a colleague through making an error and second victim's awareness, therefore, is the second piece. The third arm is the just culture framework. It is saying that in a complex environment, mistakes may happen, but if they do, the process will be handled fairly and in consideration of individual and system-level factors. In conclusion, we continue to conduct this research in the hopes of helping nurses and other healthcare practitioners deliver quality care. We want to prevent errors in the first place, but also offer understanding when they do occur.